I am Janae Sharp from the Sharp Index, and we are sitting down today to talk to Dr. Jessi Gold. And I tried to think of a lot of weird questions to ask her since I've known her for a while. Do you want to introduce yourself to the audience?
Sure. Hi, people. My name is Jessi Gold. I'm a psychiatrist and an assistant professor at Washington University in St. Louis School of Medicine. I'm also the director of wellness engagement and outreach in our department, which just means I do a lot about physician and healthcare worker mental health and run around and give talks on it and that sort of thing in the hospital.
Yes. And you also won an award from us. This is the second time.
Yes. I think one's for advocacy and one's for writing. I don't know. Maybe it's not for writing. I forget what
No,
it's
it is.
called.
It is. It's for like press. I think you do something that I haven't seen a lot of other places. Like you make it very simple, and also you're in popular magazines, that a lot of people read, but also require a different perspective. How did that come about?
I started writing in med school, sort of like journaling, and did a lot of those medical blogs that exist. And then also wrote a piece about an experience I had as a med student that went into Annals of Internal Medicine. And then as I got to residency, in part because I got good feedback on writing and I hadn't on anything else in medicine, I was like, oh, I'm going to keep residency, like I'm going to keep writing in residency. And so I tried to figure out how to do that and kind of worked no connections and ended up direct messaging a bunch of editors for like traditionally women's magazines. And I did not have a Twitter following like I do now. I had like 2,000 followers or less. And
I
they
remember
kind of
we were friends back then.
Yes, we were friends back then. They linked me to the people who like do wellness or mental health for their like particular magazines, and that's how I got started writing at Self. That's how I wrote at Glamour, and then my editor there moved to InStyle. How I actually developed a voice in writing is, I guess, it's just how I talk and write and stuff. I think editors kind of bring out in you what they think would be helpful. So I often really appreciate how much I learned from that experience. And they'll be like, oh, well, if I was a psychiatrist, this is what I think, and like, if I'm a patient reading this, this is what I would want to know. And like things that I kind of take for granted sometimes when I'm writing, or wouldn't even think people would find interesting. Like sometimes they add that back into stuff that I'm writing. And I think that's really helpful. Otherwise, I see college kids and healthcare workers as my primary populations, and I think have always been a person who doesn't talk in a way that is elevated and confusing to people. And because I see college kids, I'm much more likely to say, like, you have this pill and it makes a bunch of stuff in your brain increase, and then that helps your mood, right? Then to go like, here's this long drawn out, like neuroscientific like how serotonin works, right? And so sometimes people want that because they like are extra scientific people. But it's just not how I think and how I kind of conceptualize stuff. And I think it's a lot easier to talk to people like that. And that's always how I've been. And that's how I'd want my doctors to talk to me. So I think that's what I write from.
That makes sense. I think you have a natural voice, like a very natural gift at making things understandable. And that's a huge gap in healthcare, like healthcare literacy or healthcare communications is something I care about a lot, especially in terms of physician mental health, because the narratives that healthcare has held about itself and the narratives from outside of healthcare are, just great.
Yeah. I'm a big believer. Like, we don't learn this stuff in school. I wish we did, but I'm a big believer in like the importance of health communication to all things. And I think, I can do as much as I can do in a one-on-one visit with somebody. We can do a lot more in writing a piece. And then on top of that, most people don't have access to me or people like me. And so if like every single patient comes in and asks the same question, I can imagine the rest of the country has that question too, and I think that part of what I can do with that platform is answer questions that I answered in my visit, but I could answer in a more like wordy narrative way for the general public to answer those questions too. And I think that has always been important to me. And I definitely use I and incorporate myself into the conversation. I think more and more over time, I wasn't as comfortable with like personal mental health conversation when I was in residency. I think that that's a fair thing. I very much look up to people who are able to do that in residency. I think it's quite hard, even in a residency, about mental health. It was always easier to talk about like what training's like, or what it's like to see a death for the first time, or what, these kind of things that happen in med school that are hard or happen in residency, and they're like odd and specific to like what we do in our job, but are not like, this is what my mental health is like. But I think over time, especially as I've seen more and more healthcare workers as patients, I felt like it's my duty in a way to like actually model that I'm not perfect and I struggle and I need help and I do get help. And I think that's a hard thing to do, but I've definitely tried to become more comfortable with that on Twitter and then in writing, because if I can't do it, why should I be telling everybody else to do it? So I think it's hard, but I've definitely gotten more used to that conversation and feeling comfortable talking about it, particularly about my own use of medicine. But I think some of that required reflection on like for myself, but also with my therapist in a lot of ways.
Yeah. Hallie also had a question for you. Hallie, you haven't introduced yourself yet, so come on camera. She had a question about something, because we reviewed a lot of the stuff, and I was thinking about what you're saying with like reflection and working with the therapist. Also, I have more comments about what you just said, because some of what has happened to me, with sharing about John's death or about stuff, knowing what to share and what not to share is really tough for people, including me. Like, I don't want to always share my business, or have strangers on the internet know what I think about blah, 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 or like, if people are like, what's it like for your kids? I'm like, none of your business, um,
Yeah, no, I get it. I mean, I think nobody teaches you that, but then the internet makes you think you should, especially younger people with things like TikTok. Like, there's a lot of desire to just tell your trauma without any reflection about what that means. I greatly appreciate the normalization point and the fact that someone needs to tell their story, but not everybody needs to, and not everyone needs to at that point in time, and not everybody needs to tell everything. I think there are things about me, I draw the line on telling people that are not my friends. And I think it's very important that I do that, because I see patients and I think I should have a right to control some of the narrative of what they know about me. But I very much don't believe in like the blank slate, like you know nothing about me thing, because I don't think it helps, particularly in the populations that I see. But I do think that it's important before you share to know why you want to share, and also like realize that some people might not like it, and you might get really hurtful comments, and even one hurtful comment in a sea of a thousand good ones is going to be the one you remember. So like, for example, I wrote this piece for InStyle about, my reflections on taking medication. And everybody said nice stuff and like retweeted it and said nice stuff. And then like one person said, you're not off of your medicine because you're addicted to it. And like, why do I know that? Like, because it stuck with me. And I was like, I know this is wrong, but it's still so frustrating to be lumped into this like complete misunderstanding of what I do and what medication does and what addiction means. And I could go on and on there, but I think like that's the thing that sticks with you. So I do think like people need to realize that even if you think what you're doing is like awesome and really needed, that not everybody's going to be like, yes, thank you for telling me your story, or they might poke holes in it in different places. And I don't think people reflect that much before they talk about themselves.
That's true. Hallie had a question about your specific article. So Hallie is with the Sharp Index, and she's an expert in social media and art. She's also come to our chat with her daughter, who's amazing. And I didn't know if you want to introduce yourself a little too.
Well, now my children won't leave me alone. Yes, I'm Hallie, and I have been working with a sharp index and have been looking and may have been stalking Jessi on Instagram and Twitter. But I did like her article that she was just talking about, saying it's titled, "I'm a psychiatrist, and even I kept my mental health meds a secret." So I was wondering, what made you think you wanted, or what made you want to keep it a secret?
I didn't know I was doing it. So I think that I was talking a lot about my therapist. And if you interact with me in real life, I also talk a lot about my therapist. And so that was very organic for me. But I don't talk about being on meds because I've been on the same medication since college with no change. And I don't see a psychiatrist. It's just like a vitamin at this point. And
Right.
I don't think I don't think about that. And so I was like, there was this time over the summer of like, I want to say 2020, where a bunch of people were self-disclosing that were healthcare workers on social. And my disclosure was like about therapy and the need for therapy when you're taking care of people who are trying to, who are struggling themselves and trying to take care of other people. But I didn't talk about meds. And then I kind of watched the conversation and realized like how many people even just mentioned that it was like, I'm on Prozac 20 period. And I was like, oh gosh, like I didn't even think about that, but I also feel uncomfortable with it. So once I started kind of reflecting on why it was neglected, in part just because I don't talk about it often, I was also aware that there was more to it than that. Like I was purposefully not doing that, and spent probably 2-3 months in therapy talking about it. Like not every day, not like every time I went, but a lot of conversations about like, where do you think that comes from? Why do you think you owe people your story? Why do you think that you like want to tell people? And like, are you really sure you're comfortable with that? And really what happened was we'd have that conversation at the same time as Britney Spears was talking a lot about her stuff and was talking about lithium and meds. And I was like, I just feel like psychiatry is going to go backwards again because people are going to think we just take away people's rights and drug them with the heaviest drugs that exist and all this stuff. And I was like, I just need to say it, and I need to say it now and rip the Band-Aid off and say it.
Plus, we need Britney Spears to somehow do like a fundraiser for mental health. I feel like this is like a dream. It's a dream. It's fine.
Yeah, maybe she will eventually. She's got a lot of things on her plate, including a $10 million or $15 million book deal or whatever they said. So
yeah,
I think we'll learn a lot through that. But I think really, I realized in a lot of ways that I had my own beliefs about what it meant to be on medication as a healthcare worker. So I didn't realize I felt that way, but with everybody else, I say, take meds, they're fine, no big deal. It's great. You need to do it. You're sad, this sort of thing. But then I realized like that I also had this like, what if people think I'm a bad doctor now? Or what if it makes my patients think differently about me and this sort of thing, which is very much like the general stigma of medication in the population. But I didn't realize I had like internalized that so much, even though I definitely don't preach that and very much don't believe that. And so I had to kind of work through where that was coming from and trying to understand it a bit more from like my perspective and how it's possible to hold both truths at the same time. But I'm glad you liked the piece. It was a long time coming, I think.
Yeah.
What would you tell that younger version of yourself from like your standpoint now? What would you tell a younger Jessi about how you feel about it?
It's so interesting because I went on meds in college, and when I think about it, I don't remember ever going, I shouldn't do this, or this is scary, or this doesn't make sense. I just took them. Like the doctor said, take the med. So I took the med, right? And I think that's very interesting, especially given how many conversations I have with people with these really strong worries about medication. It was like, I hadn't even thought about any of that. I was just like, I guess they said take meds, I'll take meds. And I think that, the understanding about what that meant in my life didn't really come till later. I never really tried to get off. I went down in dose once and wasn't a great idea. But often people figure out how important meds are when they try to not be taking meds. But I think I really realized that like it had all these connotations and that, it was part of how I thought. So I mean, I think when I was in college, I wouldn't have needed it, but maybe in med school could have used a bit of a like, you're in this field that's epically broken. It's okay to be human and continue to be human. And even though you keep telling people that it's hard and you hate it and you want to quit, lots of people feel like that too. Not the medication part, medical school, and they just don't say it out loud because it's not acceptable to say out loud. And hopefully, I think that's changed a little, but I think it's really hard within the context of like evaluations and hierarchy to actually say that stuff out loud in those moments because if you're me you get written up for being like disrespectful or whatever in your evaluations because you questioned something or you didn't think it was good for your health or you're too nice to nursing was like something someone said and I was like I don't know what that
Like,
means.
that's not the worst thing.
Are you saying that like I shouldn't talk to the nurses? Like I don't understand what this evaluation means, but I think you internalize that as like I don't belong in medicine, or I can't do this. Why should I keep doing this? And I still have that sometimes because I think academics is quite hard with that kind of concept. But I say sometimes like the only way to fix the system for me is like to stay in it as long as I can. So I'm trying, I don't know that it'll be like that forever.
I don't know either. I think a lot about like the stigma of what we share. I do think the narratives around physician mental health and mental health in general are different, like people can say they're struggling now. I was also thinking like when I first started talking about this stuff, like I never wanted to talk about certain things, and that was maybe not the best idea, but I don't know.
Not talk about
Like
them.
you do what you can and hope that people understand that like it's like you're learning to.
Yeah. I mean, I think that we connected in part over your story, but honestly, I haven't really seen very many people talk openly about anybody in their lifetime by suicide who was in healthcare. And so, like being able to read the story and understand it and understand the impact, I think is quite important. And I would say you had to have been one of the first people like openly doing that, at least through like the forums that would reach a good amount of people. Like maybe somebody's doing that in their med school or they're doing that in their residency program, but like in a public platform and on social and things like that. So, I mean, I think it made a difference in how I think about stuff, if that helps you at all.
Oh, for me, it was hard because I was like angry. Like I came from a place of anger and entitlement. Like I was like, look, like my kid's dad is dead. You guys are being fuckers. like, and we're just going to have to give them what they deserve. Like, and you guys can fix this. Like, if you're healthcare and this is a healthcare family, like, show up for the people that need you because that's important. But also, when I started talking about it, every physician that I talked to, they were like hungry for the platform and wanted to talk to me about someone in residency that died. Like I ended up having like a little bit of training for how to like deal with like mental health first aid and like how to like separate myself from the trauma because it gets to be a lot. Like I think I found like a random blog about, former spouse dying by suicide while I was going through it. And it was so helpful for me. And I wanted that to be available to more people, but also I wanted healthcare to recognize that like mental health death is still death. So why are we treating it like it's not? But back to what you said, like there weren't enough people talking about it. And the way they talked about it was full of like guilt and shame and a lack of peace. And I think that's something that we still don't have. Like, we still are so uncomfortable with death that that it comes across in our ability to help people with mental illness.
Do you feel like you got more pity from people and they were just like showing up because they're like, oh, she has this platform now, and so do you think they were coming from that, or where do you think you drew the line between understanding where people were genuinely like coming to support you versus like, oh, I read this and just want to be like a good Samaritan kind of thing?
Well, I work in health IT, so a lot of places just want attention. You know, they're like, well, our thing helps with clinician burnout, which maybe it does, but it's like, okay, good for you. There are a lot of people who care, but their care doesn't mean anything. Like, I used to joke around. I was like, well, how much do you care in dollars? So the answer is that people come from like different places. Like, some of them want to help, some of them want attention. A lot of them want a space for them. Like, they need space for their own mental health experience. So I try to be really cognizant of that when someone comes to me, it's not usually about my story. It's about the whole inside of their story that they relate to. Because I'm not like the perfect advocate. Like, I'm a mom. Like, I'm messy. I'm sarcastic. Like, I swear. You know, like, sometimes I'm a hot mess. And that was hard. Yeah, people are like, people were not. People are very uncomfortable with imperfection in themselves, and I saw that, like, because I'm not, I'm not some angel. They're like, who is this lady? Like, she's not a saint. And I'm like, I literally am not a saint. Like, for someone who worked for a church for many years, like, but when people like, maybe they're mad about that, but also they're trying. It's about them. Jessi, were you going to say something?
Oh, that there aren't perfect advocates. It's not possible. Like, life is really messy, and like these kind of things would make you have a messier life. It's just the way that it is, I think people forget that, like, disclosure breeds disclosure, and sometimes people tell stories not realizing that then means they have to hold them for other people. And like, my job is that. It's very hard. Like,
you're probably good at it though.
Thank you. But it's not like, everything that I'm burnt out about or sometimes struggling with or tired of my sleep all the time is because I listen to stories all day, right? So if you're not ready to do that, it can be a lot. And like, sometimes, like, I don't want to go on social media because people are doing the same thing for me, right? Like, in my direct messages, and like, it's not horrible. Like, I don't respond to anything that's like really patient care, but I get a lot of like, can you connect me to treatment? This is what's going on with me. And like, oh, I've never told anyone this, but this is what I'm struggling with. Do you have any ideas? And like, they're not acute, and I can be helpful a little bit. And if I have the energy or the capacity, I'll do it. I wish it was easier to know a person who does what I do everywhere in the country or something, but I think that's a hard question that I get a lot. But, it doesn't make social always fun, right? Like, I like a lot of things about social. I have a lot of good community on social and have made real friends from social, including you. But I think, that at the height of the pandemic, I had to shut off like this, oh my gosh, you have to go on social and help people urge. Like, I already did that all day. Like, I don't need to go do more of that. But there was just so much need, especially in healthcare workers, like especially right at the beginning too, just like people not knowing what to do with all of their feelings and stuff. And I think, I'm happy to be that person, and I'm used to being that person, but sometimes I can't.
Right. I love that.
So where do you make boundaries for yourself? How do you keep your peace?
Hallie and I have been talking about this book about boundaries.
Is it called Boundaries? What's it called?
It's by Nedra Tawwab. Set Boundaries, Find Peace. I think.
I have a book. I do have the book called Boundaries, by the way. I have.
I figured they're like, I mean, how do I set boundaries? Ask my therapist. I'm not well, right? Like, I mean, I struggle a lot with the fact that a lot of what I find comforting and coping is actually still work. So writing is not my job, but I find writing to be relaxing. However, when I write for other people, that's still a job, right? Like that's not a coping skill. And I've been struggling with how to like say just because you don't hate this as much or this is enjoyable for you doesn't mean you should keep doing work and things. um I've also worked pretty hard at being able to better evaluate opportunities, which I told Janae. But it's sort of just like this, like when I was younger, people would ask me to do a lot of things, and I would be like, this is not something I'm interested in. This is something I'm interested in. And maybe this is something I have to do to like build my resume and connect with people, right? I don't have as much of the things I'm not interested in that are asked to me anymore. It's often like talks in the things I know, or, like helping out somebody develop something in the things I know, whatever. They're all like things I enjoy or could enjoy. And so I have to instead not use like, is this not helpful? Unhelpful criterion. I have to be like, do I have the capacity to do that? What is the point of this for me? Like, how do I, say yes to this thing? And like, what is that doing for me emotionally and like in my own life? And so I've been trying to do better with that. I think it's a hard thing. I mean, I think if you talk to my therapist and asked her how my boundaries were, she would probably be like, we're working on it. I mean, I think that it's been like a big conversation in COVID, especially because like, it's very easy when you work from home, when you don't really like working from home, but you're there anyway, to just keep doing stuff. Like, when's my day over? I mean, I guess it's over when patients are over or whatever, but it's really easy to just keep working or keep doing other things and not realize that you did that and that you don't have much separation, especially with working at home. So, there's a lot to work on with that topic in particular. And I wish we taught it in school, like at a young age, honestly, because I do think it's a skill that like it feels like you don't learn until you're struggling with it. Like, you should have them, but it's okay. That's just saying no to some stuff. And then it gets to a point where it's like 100 instead of like a 10, right? Like you're way past the point of no return when you realize you need to work on boundaries. So I don't know. I wish we had some awareness earlier.
That's actually really tough.
Yeah.
I don't know. Boundaries are interesting. I just had a family member that was like, well, some people just aren't good at them. And I wonder if it's one of those things where people don't know if they're bad at them.
I mean, there's probably some people where that's like inherent in their personality too, right? Like some people just have bad boundaries, but
Yeah.
some of it is like a learning experience and stuff we're all working on. I mean, I think you can learn things in what you do and still be horrible at doing them. I mean, I really didn't know I was burnt out until my therapist told me I was burnt out, and I run around and give lectures on burnout. So, I mean, I don't think it's just knowing things and saying them and believing them and caring about them. There's like a whole nother part of like embodying it that I'm not good at and I'm working on. And I guess in a way, like I'm also an imperfect advocate, right? Like, I mean, I'd love to be like, of course I do self-care like all the time. And I wake up in the morning and I do meditate. Like I'm sleeping in
endless time and endless money.
Yeah, like I mean, honestly, like I'm sleeping in until I have to wake up. I'd much rather watch television than do any other coping skill. And it's not apparently an active coping skill. So I'm working on it. But I think, it's not.
Wait, television isn't an active coping skill?
No,
But what
because
about
you can like zone out and it
what
doesn't
about like
engage your brain.
Pokemon Go or Animal Crossing? Just
It might more because you have to do something. And same with reading. I've been told that reading is a better idea because it like engages. Television has its own purpose, but you check out and you don't really have to pay attention completely. And so the checking out is nice, but apparently it doesn't help as much as coping because you're not like actively engaged. I don't know. This is something that I'm learning about.
I didn't know that.
Because I've always been a television person like forever. But either way, I mean, I'm not I joke that I'm like the burned out burnout advocate, and that's like become my thing because like I was just the the lead in a New York Times article about burnout, and I was like, I didn't know that was happening based on what I said on the interview, and I was the lead, and I was like, okay, this is my jam now, I guess. Like,
Yeah, that's
you know,
okay. Yeah, it could be your thing. I feel like with all the people requesting help through the nonprofit, and like I think we have a lot of people waiting for help with childcare and for everything. And we were trying to get people into like group mental health or individual therapy like 3 years ago, and it was just like 4 years ago, and it was just like a no-go, you know. And now it was overwhelming, and I get burned out, and then I realize I just don't care like about things that I normally care about. It'll be like, you know, like news or something that like I actually really like. I'm just like, okay, cool. Like, how does that help me with homeschooling my kids? Because honestly, like I have zero bandwidth. And I worry about that for physicians too, because this is going on too long for people to be able to sustain it with adrenaline or with like short-term fixes that kind of help, like mental health wise. People are just quitting. And like, I think it was last month, I was like, I think I might be done with this, just period. Just done. But like, really, I probably needed like a week off.
yeah, I think you like with the pandemic, people have really spent a lot of time reflecting on like values and how what they're doing lines up with their values. And that has led a lot of people to not like the workplace when they go back to the workplace. And it's a privilege to be able to leave a workplace. And I get that. But I think that's where that comes from in a lot of ways, which is like, turns out I value being home for dinner. Like I haven't done that in 2 years because of my job. I need to change my job, right? Like that's what people think. And so it's not as easy to do for physicians just because of time investment and financial investment and identity investment, but they'll get there. I think we're seeing more people do that just because it's like at a certain point, if it's not making you happy, even though you thought it was going to make you happy, you know, you have to do something else. It's a long life. I mean, part of the problem with becoming a physician is we're not really allowed to question it along the way. So a lot of people get to like attending hood and whatever, and then they're like, why am I doing this? But they didn't question it the rest of the time because, oh, that's just med school, that's just residency, whatever, and you don't, it'll be fine when you're grown up and you don't have to do that anymore, right? And
Right.
so it's just people don't have a lot of time to do that, and at the same time they picked a field based on like a 1 to 2 month rotation. Like how the heck do you know what it actually is like in a real career, right? And so I think, you know, people are making those decisions in a very powerful, important, strong way. And I think that we have to do that sometimes. I mean, I think that's what's powerful about people like Simone Biles, right? Which is like you can be the best at what you do, but you can still say, like, no, I don't want to do this anymore, or I can't, or I'm not healthy, or whatever. And not a lot of people see that or do that because it's not modeled for you at all, right? But at the same time, like, I wish it was because I think it is, you have to find ways to value yourself in that way. And like you said, like sometimes you just need a vacation. You can always try that first. You know, I think when I'm most burnt out, like days off more than days off are needed. You know, like sometimes I'll come back from like a long weekend and be like, why am I still like tired? And my therapist will say, like, you took like one bucket of water out of a sinking ship. Like you have a lot of other time that you need to give yourself for that to have worked, you know? And so I'm trying to do better about like planning vacations ahead of time so I can't cancel them and feel guilty about the fact that I spend so much time doing like academic stuff that takes me out of the office and people have to cover. But I didn't do very well with vacation and time off and things like that over COVID at all.
I think that's an important topic too in terms of like mental health and health equity. As like the only parent, you know, I think about this sometimes because people like take time for you, you know, why aren't men stepping up to watch their kids? I'm like, you know, like their dad does as much as I would expect. Um, which like because people are really, making it an issue of like gender, which it is, but also I'm able to talk about it, but I'm not the only one in that boat where can you actually take time off? They have all those things that say like if you're too stressed, like your body will make you sick. And I think more people are barely making it than we kind of represent with our discussions of self-care and with our discussions of mental health in general and in healthcare. Like what does that actually look like when people take a break? What does it look like when you get sick? Like, can a physician who just finished school get sick? Are you just like in trouble? And I think about it from my perspective too, like when you recognize you're burned out, or when physicians recognize they're burned out, there's a weird in between limbo space that I think isn't as clear. Like what is self-care actually when your job's going to be too much no matter what? So that's a real question. Like what is that actually,
Yeah. I mean, self-care is a hard term. I think people struggle with all terms we use to describe things that mean valuing yourself in some capacity. So resilience also makes people have a lot of like.
I hate that word. Sorry. I have because people are like, you're so resilient. And I'm like, did you think I wanted to be?
But the reason you hate it is the same reason that you hate self-care, which is the use of it, not the word itself and what it inherently means. Like when people say be resilient or like we should work on resilience in something, like what they're really saying is that this system is broken. The system's going to keep being broken. Would you like not to quit? Here's some ideas, right? That's what resilience is to me.
Or what they're saying is, I'm not going to help, but you're so strong, you're so resilient.
Yeah, but I think that's the problem, which is we framed it like that, but that's not the right term, right? Like when they say those things, people feel like the hospital is saying, I'm not doing anything for you. And that's how it's been framed for a while. But really what we should mean when we talk about resiliency is both. Right. Like the system is broken. We need to change the system. Systematic change and culture change takes years. If you would like to stay in your job, you have to figure out how to tolerate it. And that to me is resilience, right? It's like the building's on fire, but you'd like to still put a mask on and hang out in the building. How? Right. And like, but we just don't talk about it like that.
Still going to stay in the building. Okay. This is where we live.
And it's where you live. You want to protect your photos and your dog. I don't know. But I think in a lot of ways, we made the way that we frame that stuff makes people think that it's solely their responsibility and they have to fix things themselves. And if you're not able to like walk out of a burning building unscathed, something is wrong with you, right? But I think it's like you're a health comms person. Like it's a product of poor health communication and word use, which is we can't even say the word resiliency because it's like been tainted. But in the same respect, like
I don't appreciate all the negative talk about yoga.
Yeah, but I mean, if you use it like in a way that feels in line with what people mean, I think people would be fine with it. It's just we're way past that point for words like that. Like there's no going back, really, And so I think it's really about how you frame things to people. It's something I believe in really strongly. Like the wording in emails matters. The way that you tell people you can't do stuff matters. Like there are lots of things that admin in hospitals cannot change and will not change tomorrow, but there's a way to validate and understand someone's experience with that thing without them feeling like it's horrible and they have no way out. And that is a product of like people don't know how to talk to other people and communicate and listen. And you can say, I can't fix that without breaking somebody, right? Like it's very much what I do in my job, which is COVID is not something I can change. Like all of these pressures of people during COVID have not been very many things I can change. And sometimes meds don't work because the whole culture's a mess, right? And it's like, I can do as much as I can to make you physically tolerate it, but beyond that, I can't fix it. And I struggled a lot with like, oh, nobody's getting better. Like I'm doing a bad job at my job. And my therapist was like, your job is not to make people better. Your job is to be there for people. And I was like, oh, good point. Like I hadn't really thought about the point that is you can be a support to someone and helpful to someone if you don't give them what they want and need, right? And we just don't do that in management. And we don't do that, especially in a management situation where the people are inherently caring about prestige and money, you know? And so it's just a problem.
That is a problem. I don't know. I think it's also a problem when I don't think it's just the framing though. I think it's also the degree of need. You know, when you're like bleeding to death, you know, like maybe someone can't fix it. Or like when I think about like grief for me, there have been times when I actually needed help and someone's just like, well, you're strong. Right. You know, I've been like, I can't do this. And sometimes someone saying like, yes, you can is great. And sometimes it's like, no, you're not listening.
With friends and stuff, I think the answer is usually like, do you want me to listen or do you want me to give you advice or what mood are you in right now? Is it helpful for me to be like positive and supportive or is it helpful for me to just listen and validate your experience, right? Like, and you need friends like that who ask or care or want to know, right? And you shouldn't be disclosing and talking about really hard things with people who don't, or it's extra traumatizing. And it happens all the time because you don't always know how people are going to respond, even when they're the best people, but you learn very quickly who you can go to that stuff with. And I think that often happens in families. You know, you go to the person that you thought you were closest to in your family and say, like, this thing happened to me. And they say like, you deserved it, or like, how come you didn't say no? And then you're traumatized forever. Right. And so I think it's a product of like having the right people around you, which is also a privilege.
Yeah, that is. That's a good point. Okay, I want to ask you more about your perspective on, there are a lot of narratives about mental health that aren't informed by, you know, since you're winning the award about like media and about writing, you know, like people don't ask experts. They like ask, you know, they like get an expert from Grey's Anatomy or something, you know, it's like House MD Psychiatry edition. Why is that, first of all? And also like, what does that mean? Like, do you feel like that has an impact on things?
I'm not sure I can answer why exactly, but I think some of it's who screams the loudest and who has the biggest platform. But, you know, one of the things that most bothers me, especially even if you compare health, just other medical specialties to mental health and like psychiatry, is like you'll see journalists ask ER doctors about like suicide and mental health. And there's definitely a component of that that they understand from being in the ER, but there's also a time they call me, right? When they don't want to handle the patient anymore, or they can't. And so it's not like the people are answering the question like, as an ER physician, I only see it in this way. And that's how that was for me, right? And so you get to thinking that mental health is not an expertise and it's just something everybody can talk about. And I think that there's a component that is informed by lived experiences. You're a lived experience person, right? And I think that you need that, which is, I don't know what that's like, but I also know a lot of other stuff. And maybe I do also know what that's like in some way, because a lot of people who are experts also have lived experiences. So I think there's like this, they're polar opposites and fight instead of like, oh, by the way, some people are both. And also there's things you can learn from both instead of like drawing the line and saying no. But I think with mental health, it's like, well, everybody can talk about feelings, or like everybody can talk about.
Wouldn't that be nice?
Well, you know, but yeah, exactly. And it's just sort of like as if I didn't train. Yeah, you know, it's like as if I didn't train an extra like 4 years in feelings, right? And so it has a reason that that was a thing.
That sounds like exhausting.
Yeah, I mean, There's a reason that they don't talk about their own emotions. They call psych consults when someone cries. And there's a reason why I'm in what I'm in and they're not. And I think it's a really big problem in journalism that people don't see my specialty as a specialty. And that therapists, same thing. Like they often, like people who are well-trained therapists often are kind of fighting with this like use of therapist as a word by people who actually aren't trained like that or are coaches, and they're just sort of changing what that means to people. And that's really hard. And I think if we don't have people who are trained talking about their training and what they know, we're making a big mistake because yes, other people can know some stuff sometimes, but that's where like misinformation comes from, you know?
Yeah, I think it does lead to some problems. Specifically in physician mental health, it leads to some interesting weirdness, Like I used to be a hospital admin and now I'm an expert here, but it's almost like they're making up for being part of the man, being part of
Yeah,
it.
I mean, for that, a lot of the people aren't psychiatrists or in mental health at all. Like
Yeah.
most of the chief wellness officers are like random other careers in medicine, right? Or the people studying wellness. Like I think, in our grant, like if you looked at recipients, we're probably one of the only departments of psychiatry that are holding the grant as
Oh,
opposed to
wow.
like medicine or something else. And that's sad. I mean, it's sort of sad. Like we should be running this stuff. Like if you're referring everyone to us, like shouldn't we be the people making the policy and having the conversations? But I don't know, we don't advocate for ourselves well enough or aren't able to put that together, or someone else is louder and someone else has been there longer. I don't know.
How does that balance with other people being involved? I mean, like I've had lived experience and I have like kind of a different background in some ways. In medicine, people like to they're competitive, and they like to publish. They like recognition. And I think sometimes it's hard for them to listen to outsiders. Like, what's the balance between getting real knowledge from a psychiatrist and that where, in this space, there's a place for you. And also like the coaches thing. Like I have friends who are like coaches. They're like, I was depressed, but then I just thought a happy thought. And then I like got out of bed and just like, why don't you treat your depression that way? I'm like, is that some weak ass depression? Like I would just say you like woke up hungover maybe, but like, but there's a spectrum, and healthcare in general is failing us in mental health. And we don't have enough psychiatrists. Like we don't have enough helpers. So I'd like to know kind of what you think about the balance, knowing we're not going to have enough psychiatrists.
I mean, I think that I don't want people to need to see me. I would rather catch them at the 800 steps before that, right? The problem is we don't. And the problem is, especially in healthcare, physicians especially come to me for magic pills because they don't want to talk about feelings, or they come, a year too late to have anything besides meds because they were trying to deal with it themselves and thought it would go away, right? So you have those ends of the spectrum. I think everything else has a place and needs to be there, and needs to be there for prevention and screening and getting people the right resources when they need them, and knowing what kind of skills to be working on, and knowing how to handle what's going on with you, and noticing signs and symptoms. All that stuff doesn't need, I mean, it can be informed by experts and should be when it has to do with like things that should be informed by experts. But ultimately, that's like, I don't want to see you. Like, fix yourself before. And not everybody can, right? Like, some of it's family history, some of it's just your brain. But if you can, we're missing a really big group of people that could. And I think some of that's peer support. And some of that is like actually having supportive departments that know how to have these conversations, or people you would go to have these conversations outside of trained mental health professionals, because it's impossible for us to fill the need. Like you could hire a bazillion therapists on a campus, like undergrad, graduate, medical school, whatever, and you're never gonna get there. Like
Right.
the N is not possible. There aren't enough N's to choose from either. But on top of that, like I'm the like severe case. That's why I went to med school, right? I went to medical school to be able to treat people who like need medication, right? And have other medical problems and they need someone like me to be helping, or their family history needs someone like me to be helping. But I don't need to treat like you've had a couple of weeks of sadness, but I would like to have had somebody get better then instead, like we just don't.
Right. Okay. Well, what questions do you have? Like, Hallie, do you have any more questions for Dr. Gold?
You
Just
can
call you
go,
Jessie.
I don't
You
know.
can
I
say
think,
no and we can always like hop off and call it a day too, because we have to soon anyway.
yeah, I think she did great.
Do you have
That's
questions?
something that I had questions on, and then I was thinking about it, and then she went into it. She's on top of it.
I'm
She's good at
verbose and
feelings.
wordy.
She's good at feelings.
Yeah, I basically went to a lot of feeling school, so I'm good.
Feeling school, yes.
That's really exhausting.
Yeah, I'm doing okay this week.
That's good. What's the first lesson of feeling school? That could be our closing question, right? That's a good question.
What's the first lesson of feeling school?
Come on, it was a good question.
Well, it depends. Like, so many people, I practice more like DBT, radical honesty, in how I practice. I think old school people maybe don't do that as much. I would say what the first thing you really learn about is like how your feelings inform your decisions, right? So if I have 20 patients that all make me angry, I should figure out what that is about them that's making me angry, because it could be something that's inherent in them and it could be something inherent in me. And I have to think about where that's coming from and figure that out, because I'm going to have to see patients like that. I probably don't appear angry. It's just like, that's how I feel afterwards, right? But I'm going to have to see those patients and deal with that and know how to. And I think in residency, especially when you're getting hospitalized patients and things like that, like you have to know what are your like points at which you can't handle things, or where are the things where you would rather give that patient to a different resident if possible, because you're not the best person for them. And I think that happens sometimes too. But I would say, at least in my feeling school, the answer is to listen to your feelings. And that is in addition, like with your job. Like I don't always do it, and I try to suppress my own feelings. I don't want to sit in anger. I don't want to sit in sadness. I want to do 400 coping skills and keep working and feel better, right? As do most people. But there is like that second.
Nobody wants to just ruminate on anger.
Yeah, but there's like that second, right, where you know that you're hanging out in that, and you can say like, what's the deal with that? Like every time I get an email from blah, I'm livid. What about that person? What about that email? What about the structure? What about you? Like, what are they pushing? And you can usually get somewhere. It might not be like completely fixable, but you can go, oh, that person is really hard for me because of this in your head, and you can kind of calm down, honestly.
I like that. How can people get in touch with you if they have questions?
Sure. I use Twitter and Instagram more than anything else, which would be at Dr. Jessi Gold, Jessi spelled Jessi. I also have a website that's just Jessi Gold, drjessigold.com. That has all my writings and things like that. Obviously, I have like author pages on Insta and stuff if you just want to go look at everything that I've done there, and that's where you want to start. I'm open to whatever, but I'm usually pretty reachable, I think.
Yeah. All right. So closing. What's one? I don't know. I don't like closing stuff. I'm never.
You can say, thanks. We'll see you later, Jessi.
Thanks. We'll see you later, Jessi.
Yeah. Listen, I don't need like some kind of fancy closing. I appreciate being here and you having these conversations and everything you give to this field, and that you had awards to recognize people at all, because we don't really get recognized, and it's nice. So that's what I'm going to end with. And you can end however you want.
Thanks. Well, I'm glad that you're here, and I'm glad that we get to give you a trophy. You deserve it. People who went to feeling school deserve way more than a trophy and champagne.
Yeah, you got it.